Are you tired of a reactive healthcare system? It's very possible that you're at home watching this. Thank you for joining us. And you have an autoimmune condition or you're struggling with a digestive problem and you feel bloated. You're just not feeling good about where you are and how you're feeling. And I just want you to know, I completely understand that. My name is Dr. Matt Lewis from Biodesign Wellness, and tonight we're going to talk about digestion and autoimmunity. I'm going to be packing this full of information for you, so just stay all the way through the end. Um, but as I was putting together this presentation, I was reminded of a patient that I just started working with about 3 or 4 months ago. It's closer to 4 months, and really nice woman. Her name was Jen, is Jen, and she came in and she came with her husband. And one of her main concerns that she told me was that she walks around and she already has children, and yet she feels pregnant. And her two children are already 10, 12 years old, but she's starting to really get pissed off because people are asking her, "Are you pregnant again?" And she's thinking in her head, "I'm 45 years old. I have two kids, and I know I'm not pregnant." And she's really aggravated. And that I think that's really what brought her in, is that it was just really getting to her. She was very uncomfortable, and she was there with her husband, like I said, and he was a really great guy, very supportive of her, and you can see that they had a great relationship. And she shared with me that, she felt that her husband, still was very attracted to her, and that was not an issue, but that she did not feel attractive to herself anymore. She didn't feel sexy. She didn't feel like really participating, being intimate with her husband. And even more than that, she felt like she started to lose herself a little bit. She was becoming snappy. She would kind of fly off the handle quickly get irritated with her children for little things. And she just told me like this was starting to cost her too much in her life, that she just felt irritable all the time, fatigued, and the bloating was at this point just driving her mad. So she wanted to get back to feeling herself again and feeling happy again. And it really reminded me of a situation that I went through over 10 years ago, about 10 years ago at this point in 2008, when during that economic crash that we had at that time. And I was in practice. I had a thriving practice, but I didn't feel well. I had post-nasal drip all the time. Never had a digestive problem, but all of a sudden I was bloated all the time. And it was very disconcerting. I was getting ready to start a family. I felt brain fog. I felt fatigue. I had pains in my joints. And I share this with you because I've been there. And if you're struggling with autoimmunity, you have a digestive concern, I understand what it feels like. I didn't know what was happening. And it took quite a long time before I was able to finally figure it out. I went to conventional doctors, being a doctor who specialized in what's called functional medicine and clinical nutrition. I visited holistic providers. I thought I knew a lot about health and how to help myself, but none of these things were working. I changed my diet. I was exercising well. And long story short, I discovered that I was working in a building that had water damage. And actually, I had developed um, a chronic inflammatory response and some overgrowth of yeast because of this air that I was essentially breathing without knowing for many years. But it took many years for someone to finally come up with that diagnosis and help me. It is something that I specialize in today for that reason. Thankfully, I was able to mostly recover. I would say I'm about 90% recovered, which is really good. If you know people that were injured in a water damaged building, it's not always easy to recover from. So I just want you to understand that um, a lot of people are struggling with autoimmunity, digestion, and they don't necessarily know why, and they're not getting good answers. This is our team over at Biodesign. You'll have an opportunity tonight if you'd like to schedule a time to speak with one of our specialists to see if, in fact, you'd be a good candidate for treatment here, if we think we can help you, and if you think that this is the right place for you and our programs are right for you, have your questions answered. There'll be no cost. It's a 15-minute call. But this is just some of our team here. Cameron, is our nutritional coach. He works with all of our patients to help them dietarily. We know that that's very important for health. Um, Phyllis and Lori, they help to bring the patients through treatment. They're there for you, handling all your calls and appointments and all that kind of thing. And Dr. Cope is our medical director. Jimmy is the owner of the clinic, and he's extremely passionate about health and wellness. And Sierra, that's our medical tech. So we have a full team here, and we're here to help you. You have an opportunity to take 15 minutes at no cost to see if it's going to be helpful to you. So getting into the presentation here, what we're going to cover in this webinar is America's health crisis. We definitely have a crisis. I don't think that that's something people don't know. I think you probably appreciate that already. I'm going to just briefly touch on that. But clearly, our healthcare system is working more like a sick care system, and it's really leaving people with small intestinal bacterial overgrowth, digestive problems, reflux, bloating, and autoimmunity. It's leaving them sort of defenseless out on their own, trying to figure out what to do. I think about patients that have come in, and we do a 3-step program, something that's called discovery, repair, and optimize. And I'll talk more about that later. But in the first part in discovery, it's clearly understanding the patient's concerns. In the case with Jen, it was really hearing what was going on with her, how her bloating made her feel, and how long had she had it, and how it was impacting her life. But then we had to do some discovery in terms of testing. And I meet with patients all the time. I wrote a blog about this, where they've had 5 or 6 gastroenterologist visits and never once a stool test. So oftentimes with a digestive concern, that might be something we want to do right away. There's also urine tests that we could use to help to identify problems actually in the gut. So we're going to teach you how to take action to protect yourself and your health naturally. And when it comes to prescriptions, just to give you kind of an idea, I mean, of course, we think prescriptions are important, right? Of course, there's a time and a place for prescription medication. I think everybody would agree with that. One of the challenges, though, I think, is that we have with prescriptions is that they might be being overused, and they're not actually treating the root cause of the problem. So if we're going with a prescription-only type of approach, where that's what we're doing, we just try to give prescription medications and try to just resolve problems that way, we're just covering up or masking the problem. Recently, you saw with Zantac, if you have problems with indigestion, maybe that's something you were using. And unfortunately, we see that it was recalled because there's cancer-causing chemicals in it. So we need to be careful with prescriptions. I think it's really important. Just think about blood pressure, right? Or heartburn medication. If you're taking heartburn medication and you come off it, the problem's still there. So clearly, we haven't treated the cause. Blood pressure medication can be life-saving, very important, prevent you from having a stroke. But when you think about it, when you come off the medication, what happens? Blood pressure problem is still there, right? So have we resolved the problem? And how important is it to actually resolve the problem? We see with this infection that's going around, people who are most at risk are those who have inflammation, those that have diabetes, heart disease, cancer. So just masking things with medicine, whether you have autoimmunity, a digestive problem, or a chronic condition like heart disease or diabetes, is not a full solution. Unfortunately, in a 5 to 10 minute visit in today's healthcare culture or sick care system, that's what we're getting. So if you're looking for something different, that's what we would offer. Now, I like to talk about the cytokine storm. What is the cytokine storm? Well, think of it like a hurricane, right? You have this hurricane, and there's that eye of the storm. In your body, your immune system has the ability to create this storm. Sometimes that's really good to get rid of a virus or a bacteria, or if you had a bug in your gut, you want to throw it up, you want to poop it out, right? You want to get it out. And that makes sense. And your body's going to secrete a lot of immune cells, or what are called cytokines, to start to make that happen. The problem is when that stays around. When you stay with that cytokine storm over long periods of time, then you can develop problems with inflammation. Inflammation is going to lead to digestive disorders, autoimmunity, cancers, obesity. It's hard to lose weight, and all kinds of dysfunction. And it can be triggered by viruses or bacterial infections, or you can have inflammation that makes you more susceptible to those infections. But the thing that's apparent is that inflammation is really at the heart of so many chronic conditions that we struggle with, including autoimmunity. Now, since we're talking about autoimmunity tonight, I want to give you just kind of a brief, very, very cursory and easy way to understand autoimmunity. And you might have lupus, and you might have Crohn's or colitis, or maybe you have celiacs or rheumatoid arthritis, multiple sclerosis. All autoimmunity, in some respects, there are different triggers, but it all acts very similar, right? So just think about your immune system like this. There's two sides to your immune system, right? Like a scale or a balance. When something triggers your immune system, it'll go out of balance like this, right? And one side goes up and the other side goes down. And the problem is it gets stuck here. Normally, you get a virus or a bacteria, it just goes back to normal. Or you have stress that can impact your immune system, goes back to normal. When it gets stuck like this, right, and you're living here, your body starts to attack itself. And it can attack your thyroid, very common, Hashimoto's or autoimmune thyroiditis, leading to hypothyroid or low thyroid, making you fatigued and your hair falling out and your skin and your nails just not being shiny, being brittle. So any autoimmune condition, though, is this dysfunction in the immune system. And in conventional medicine, the treatment for that is let's try to balance the immune system with medications. If it's your thyroid, let's give you thyroid medication to support your thyroid. If it's your joints, we'll give you an anti-inflammatory and maybe use some biologicals again to try to help the immune system. And while that can be helpful, it is not addressing the underlying reason that you've been triggered in the first place. This is why oftentimes the patient doesn't feel better. Now, of course, digestion has a connection to autoimmunity, which is why we're talking about that. And I'll get to that in my presentation here. So you do have control, and you can take control right now. You can improve your immunity. You can improve your digestion. We need to be proactive, right? And I'm sure that's why you're here. I want you to start to consider food like medicine. And so let's think about that one for a second. If you have autoimmunity, are there foods or you have a digestive issue that maybe you want to stay away from or be clear of? And I'm sure many of you have tried things like cutting out gluten in your diet or reducing your sugars, maybe taking dairy out. And over 20 years of treating people with digestive disorders and autoimmunity in a more natural, holistic way, looking at the whole picture, I can tell you without doubt that diet is going to be very important in the process of healing. I can also tell you that it's not the whole story, but it is a big part of starting to feel better. So if you've taken gluten or dairy out of your diet, you may have felt better temporarily and then the problem came back. And it's likely because there are other issues there that haven't been resolved that you just didn't know about. That's fine. If you've never tried that before, what you probably find is you feel better when you do that, although again, it may not fully resolve the situation. For some people, it really can resolve a lot, but for many, it's just a part of the equation. So with autoimmunity, we definitely need to change the diet. It needs to be more anti-inflammatory. I find that it needs to be fairly specific to the person, but by making adjustments to your diet, you will be helped. And if the doctors are ignoring that and nobody's working with you very specifically on your diet and tracking you and helping you with that, it can be a very frustrating experience, and it leads to a lot of failures. You can boost your immune system. There are different supplements that you can take. Things like quercetin help to support your immune system, vitamin C, zinc. Obviously, these are basic things, vitamin D, that you should be taking for your immune system, especially even if you don't have autoimmunity. But if you have autoimmunity, why wouldn't we want to support your immune system? These are things that can modulate that expression and calm the immune system. They also can help protect against viruses and bacteria. So you can calm autoimmunity, you can balance hormones. All these things can happen. If you are just tuning in, we're talking about America's healthcare crisis, which is that we just basically slap drugs on everything. We don't really look for causes, and we give you a 7 or 10-minute office visit. That's not going to do it. And I think most people know that. We're talking about digestion, small intestinal bacterial overgrowth, reflux, bloating, and then how you can take action to protect yourself. If you're ready and you know that you want to speak with somebody who's familiar with this, You have an opportunity for a 15-minute consultation. One of our specialists will talk to you, see if this is something that would be a good fit for you, have your questions answered. So at any time during my presentation, you can go ahead and do that, and we'd be happy to talk with you. So autoimmune conditions definitely require a holistic approach. There's just no doubt in my mind that that is absolutely true. Whether you have lupus, Hashimoto's, rheumatoid arthritis, multiple sclerosis, celiac, Crohn's, colitis, a mixed connective tissue disorder, and even chronic fatigue and fibromyalgia, I would put those on a spectrum of autoimmunity because there's an autoimmune dysregulation. And you'll see a lot of people with chronic fatigue and fibromyalgia will have, high ANAs, so ANA titers that are off showing autoimmunity. They might have anticardiolipin antibodies, which are another sign of autoimmunity. So even if you don't have an autoimmune test that's positive yet, it could be because the right tests haven't been run. But it also could be because sometimes your immune system hasn't reached this point yet where it's totally flipped and you can see the attack. It usually takes about 75% progression to do that. So you might be here. So it's really common that we'll have a patient come into the office with a story of, my brain's not working, my joints hurt, I feel fatigued, I'm bloated, I have a lot of gas, and there's just all of these symptoms. It's not like one thing. When someone has autoimmunity, they're usually complaining of multiple symptoms. And again, oftentimes tied to the digestive system, because the digestive system is what largely controls your immune system. That's a first line responder. You have a very, very large portion of your of your immune system is actually housed inside your digestive system. So those two things are very well connected, as well as your gut to your brain. When your gut doesn't feel good, I had a patient just the other day telling me how, her brain is so foggy, she feels like she can barely work anymore. And she didn't even have any kind of injury to her brain or anything like that. She's just got a really bad, what we call leaky gut. She's got overgrowth of yeast in her digestive system, and it's directly impacting her brain. All right. So that can happen. Very common. So the way I look at this to try to give you a clear picture of things is just look at the inflammation. The end result of all of how you feel, your symptoms are going to be related to how much inflammation you have. And just think of that like your bucket, and your liver and your kidneys and your intestines are sort of the bucket. And everything is going into your bucket, and you can put your brain in that category too. And it's going into the bucket, and at some point in life, for different reasons, it overflows. What I call that is burnout. So many people have experienced this. I can say most people have, and I think if you're listening to this, there's a good chance that you have, where you get to a point in your life where you're just not feeling like yourself and you feel a little bit burnt out. And if that's happening, it just means your bucket has overflowed. So let's look inside that bucket and see what that means. And to share with you that I was scared because I got to a point in my life in 2008 where my bucket definitely overflowed. Again, I didn't know why. I didn't necessarily know how to correct it. I couldn't find a doctor to help me to correct it. But clearly that's what was happening. And when that happens, you lose resilience and you start to get anxiety and you get fear because you don't know, am I going to be able to take care of my family? Am I going to be able to work if you're the breadwinner? If you're taking care of your children, are you going to show up as the best mom? So it's just hard to know when you don't feel good. So let's look inside this bucket. Let's see what it's made of and see. This really gives you the key to how do you heal. So what I found in practice over the last 20 years is that there's more than these 11 things, but there are some main contributors to what is filling up our bucket. This is not in any order. It's just a list of different things that could be potentially affecting a person. So number one is infection. Number two, virus. So infections could be Lyme disease, H. pylori bacteria affecting the gut. There are various parasitical infections that can affect your gut if you're having digestive symptoms. And then viruses, of course, right? So viruses like Epstein-Barr virus, herpes viruses, all kinds of viruses, a flu virus, obviously COVID-19 now we're dealing with, water damaged buildings. That's what made me sick. When you're in a building that has water damage, and if you're not aware, even in your HVAC system in your home, especially if you're here, our practice is in Tampa, but we do virtual appointments. We've been doing virtual appointments before COVID-19. We're doing more of them now. So we see people from all over the United States and beyond. And very, very commonly, when I have somebody come in with small intestinal bacteria overgrowth, it's because they've developed yeast in their digestive tract or bacteria that are growing in the air conditioning system in their home, which is a result of being in an indoor environment that the air conditioning gets humid inside there, go from wet to dry, and you create this condition for microbial growth. So you're breathing that air. It's the lungs of the home. This is one of the very kind of unknown causes of a lot of illness. So when I find patients with autoimmunity, I almost always find some kind of water damage, previous history. Maybe they worked in a school building, maybe they worked in an older building, or coming from their home, or it could be a current exposure. Either way, it can make you sick. Just like an infection, just like a virus can make you sick when you got it, and when you first got, let's say, Epstein-Barr virus that causes mono, or 20 years later, it could still be making you sick. Same thing with shingles. So just understand, when something goes into that bucket, it doesn't necessarily just leave. And so if your diet, we all know diet is so important. If I ate a lot of sugar, if I was taking in a lot of antibiotics, if I had a lot of alcohol, all of these things have an impact. Processed foods, pesticides, overconsumption of grains and sugars, all of these things have an impact on your gut, your digestion, and your immune system. And this is why, again, it takes a more balanced, holistic approach to really help to heal yourself and find some better management for this autoimmune condition that you might have, whether it's rheumatoid or lupus or just a digestive complaint. So deficiencies in minerals and vitamins are so important, right? You can have deficiencies in any kind of vitamins, thiamine, B1, B2, selenium, zinc. It's really common that I'll check these vitamin levels in people's blood and or in their urine or their hair. And what we see deficiencies all the time, even in people that are supplemented. So I just had a woman today that I spoke to. She's been taking different supplements for many, many years and struggling with different health concerns related to autoimmunity, related to digestion. And we just looked at a specialized test for her. It's a urine test, and it gives us an idea of bacterial markers and fungal markers that are coming from the intestines that show us if there's an infection or a virus or some yeast overgrowth. And one of the markers we look for is actually vitamin C, and there are metabolites of vitamin C that we can see, and she was deficient there even after years and years of supplementing. So she wasn't taking enough. 1,000, 2,000 milligrams of vitamin C for her was not enough. So knowing your levels is so important, and then getting the right dosage and working with somebody to make sure is just so important. So again, when I speak about this bucket, there are a lot of different things that potentially go into this bucket. You can have a hormone imbalance, which will cause tons of bloating. You can have autoimmune responses that then create more inflammation, and it becomes a vicious cycle. If your exercise habits aren't good, right, that's very important. But you might be so tired right now that you feel, you just can't exercise. You're too tired. Totally understood. But we need to get you to a place where you can then exercise, where you can start slowly. Sleep. If you want to boost your immune system, sleep is just going to be 100% necessary. There is just no way around that. And taking sleeping aids is not necessarily getting good sleep. Taking prescription medication for that, again, I can see where it's helpful, but it's not going to resolve the issue. So very important we get good sleep, reduce our stress levels. You can fill up your bucket with chronic stress alone. That's all it takes. If you have a poor relationship, if you went through divorce, and that could have really taxed your body. And I know I talk to couples all the time, who have been through divorce, and maybe they're remarried, but even just, they're handling children from another marriage. It can be very stressful. Look, those are part of life stress. At one point, when your bucket wasn't overflowing, you could deal with that. But as the bucket overflowed, you lost resilience. You become depressed, anxious. And so it's all about building resilience. That's really the key, is to empty your bucket. So when we go through a program in our office of discovery and then repair, In repair, we want to start to help you to empty the bucket. All right. That when you empty the bucket, discovery, you find all these causes we're talking about. Then you know what to do to empty the bucket. So think about what's in your bucket, right? And really pay attention to that. And that's the kind of thing we'll share in a consultation. And part of figuring out what's in the bucket is to run the discovery, run the test. Here, I'm just sharing with you that if you have, small intestinal bacterial overgrowth, what that means is you've had a situation where there's too much yeast or bacteria that's overgrown in your digestive tract. It can also come from a vagal nerve dysfunction where your nerves that actually take care of digestion are not functioning properly anymore. They're out of balance. And so it's caused inflammation in your body. And we know that digestive problems are going to cause joint pains, brain fog, and ultimately the immune system to be weak. So there are some really great peptides. Peptides are like proteins that your body normally makes. As we age or if we have inflammation, our ability to produce these could suffer, they could slow down or be reduced. And so there's a peptide called BPC. I think it's on here incorrectly, sorry. BPC 157. And what it does is it can modulate immune responses. There are studies that show it actually can heal the esophagitis, which is inflammation in the esophagus. It helps the stomach and the stomach lining. So very important, something I've used in my practice and used personally. It helped me a lot to heal. And then something called thymosin. You have a thymus gland, and as we age, that gland, which is there for your immune system, it helps you to make antibodies and natural killer cells, and those are very important immune cells. So as your thymus gland shrinks as we age, you just don't get enough of this thymosin peptide. So if you have autoimmunity or even a digestive concern or joint problem, thymosin can help. So these are some of the therapies that we might consider. So, excuse me. All right. So as I said, in our protocol, we're going to look at 3 different phases: discovery, repair, and optimization. And if you remember the story I was telling you earlier in this presentation, Jen was a patient that came in with very severe bloating, looked like she was pregnant all the time. She was unhappy with the way her pants fit her. At the end of the day, she had to unbutton them. She couldn't even keep them buttoned. She was not happy. And so we brought her through this 3-step process. And what we actually discovered through doing a urine test to look for yeast and overgrowth in her intestines, we found that there was a yeast overgrowth. We also found that there was some bacterial overgrowth, and we saw that in the stool test. In the stool test, we also saw that she was making too much of a protein that showed us that she had a leaky gut. So that protein being in her stool was the indicator that her gut was leaky. So that gave us a pathway to help her by running those tests. Then we did a gut repair. We did do a detox for her liver, because over time, when you build inflammation in your body, the filters like your liver and your kidney, they're not working as well. And that will cause you to be even more bloated. We did do a liver detox. We did a gut repair. And that was part of her program over a 6-month period to have her heal. And then, of course, now, this has only been about 4 months, we're working on optimization with her. She's gotten great results. She called me the other day. We did a consultation. And I'm just so happy because she was happy. And it just really feels good when a patient calls you and you get to have a great conversation about, she's been struggling for years with this issue. And now she told me, like, you know what, Dr. Lewis, I just feel like myself. I don't have to worry about my pants at the end of the day. I look in the mirror and I'm just feeling happier. And the people around me can see it. My husband, he's just so relieved that I feel better. And just a great story. And, that's what we wish for you. And take an opportunity. You can spend 15 minutes on the phone with one of our specialists. They will speak with you, answer your questions, see if this is the right thing for you, right program for you. They can also confirm that they think and we think that this would be a good step for you. Normally, after that 15-minute call, you'd be scheduled for an hour consultation with me where we would get into more details on the discovery and what your concerns are. So, but first, let's see if we think it's a good fit and have your questions answered. So We talked earlier about prescriptions and how that just is not the whole solution. And we really need to put our focus on more than just that. And I want you to think about what your reason is. Why is it so important for you to reach your optimal health, to not feel bloated, to not have the digestive pains? Um, and it's frustrating because you're going to doctors and they're not really giving you answers, and you're not finding answers on your own. And you really need somebody to consult with you and work with you. But think about like who in your life matters, right? Because in Jen's case, it wasn't just um, her that was being affected. It was her husband, right? And her relationship with her husband, but it was costing her something, and her kids. And she recognized that. That's why she wanted to get help. And it's so important because, like, for me, this is my wife, and that's her name is Dipti, and my two kids, Ava and Gia. And when I was not feeling well, you know, first of all, I didn't have the kids at that time. I was just starting my family, but I was concerned about how I would be able to start this family and not make a living if I'm not feeling well and just feeling burnt out. And it was very important for me to be able to do that. So it would have had a very severe impact on my family's life. And I'm glad to say that I was able to figure out what was going on and recover. And that's what I hope for you. I hope you can do the same thing, like Jen did. We started out, 4 months ago, same way we do now with a lot of patients through a virtual consultation. She thought it was the right thing. We went on to an hour consultation, and now we're 4 months into her protocol, and she's very happy that she did so. So I would love to handle any questions that you have. So if you have any questions, please put your questions in the comment box here. If we don't get to them now, we will get to them later. I want to thank you for attending and taking this time for your health tonight. Most importantly, I just feel like so many people are lost, and they don't know what to do with regards to their digestive concerns, their autoimmunity. And what I hope that you gather is that there is, you can lose some of the fear and you can gain hope. And that's really what I want you to do, is through education, through a better understanding of your concern, through actually spending time in consultation, is that you can figure that out. And if you like, like I said, we can do that together. Take 15 minutes, speak with one of our specialists first, and see if it's the right thing for you. I hope that you start to feel better soon. I'm Dr. Lewis. And if there's topics that you want to hear more about, please put that in our box also. But I'm Dr. Lewis from BioDesign Wellness, and I look forward to hopefully meeting you soon.